In 1981, after 3 years of service, the volunteer-run Chase Brexton Healthcare first heard about a mysterious illness in the gay community. Until then, the tiny clinic, open 2 nights a week, focused mainly on sexually transmitted infections. The Centers for Disease Control and Prevention initially thought the disease was a type of cancer attacking gay men, and they named the disease Gay-Related Immune Deficiency, or GRID. That name and the constant referral to AIDS being a homosexual disease created a lasting stigma for the gay community.
Like many young gay physicians at that time, were in a place and time where all of a sudden there was this problem and you take care of it. We did not, in general, get a lot of good support from our colleagues in the general medical community. They didn't want to be involved. They didn't want to see our patients if they knew it was a patient with AIDS.
In 1984, the virus that causes AIDS was discovered. However, knowing the virus, human immunodeficiency virus, or HIV, did nothing to reduce the fear and stigma attached to it. Fear of the disease led to the creation of restrictions and bans that would last for decades, and struck healthcare providers particularly hard.
I went through a very difficult soul-searching period to say, can I stay in this line of work? Because I have to make a decision. I can't be frightened and do it at the same time. So either I have to get over it or I have to change my line of work.
In that first decade, making patients comfortable, making them feel safe, was mainly all that could be done.
There was huge stigma, far more than now, about HIV, and we were, in many cases, the only people that knew they were positive.
Worse than the stigma, death loomed. During the first decade or so, 90% of those with HIV would die from AIDS-related illnesses. Monthly memorials were held for Chase Brexton's staff, and in 1995, Chase Brexton created Maryland's only AIDS memorial, the Wall of Courage. Chase Brexton's participation in national HIV drug trials helped to pave the way to solutions. By 1997, highly active antiretroviral therapy, or HAART, was shown to be life-saving.
We had drugs, and I'll tell you, the first thing, our patients stopped dying. We didn't go to funerals. We used to go to funerals those first couple of years.
At the turn of the century, we slowly began to see that the advances in treatment were helping HIV to become a chronic, more manageable disease. The approval of rapid HIV testing allowed providers to get patients into HIV care more quickly. And as the decades wore on, slight changes to the bans created in the 1980s were finally occurring. Today, while we still struggle with stigma and misinformation, much has improved. Treatment is simpler and more effective. Prevention options have been expanded. In 2012, the FDA approved the first medication to be used as a pre-exposure prophylaxis. In 2019, multiple global health organizations finally promoted U=U. Treatment that successfully suppresses HIV is a form of prevention. Those with virally suppressed HIV cannot pass HIV through sex. At Chase Brexton, we have added a third new testing van to help make HIV testing easier for those who are hesitant to get tested. And most importantly, to ensure patients receive their medications to stay undetectable and live healthier, longer lives, we are increasing our free, confidential prescription delivery service. The expansion of our free pharmacy delivery service could not have been possible without the fundraising efforts of all of this year's virtual AIDS Walk-in Music Fest participants. And we'd especially like to shout out this year's winners. Our top fundraising staff team, 3 balance sheets to the wind, our top fundraising staff member, Shalin Patel, and our top social media sharer, Derek Briner. Congratulations for all of your hard work, and thank you for your passionate dedication to ending HIV.